2022. We have an exciting hour planned for you today. Let's get going forward and do just kind of our agenda and introductions. So I'm Kristen Killen. I'm a consultant at CERC. I am here with my colleague, Steve Profit. And we are very excited to join you today, along with Kari Sullivan-Custer from CSDE and Jay Brown as well. And we have our special presenters for today. We have Kristen Soto, and she is from the Connecticut Department of Public Health and going to talk about Connecticut Weekly Respiratory Viral Disease Trends Report. We're looking kind of forward to that, especially the infectious diseases and the what's going on right now with our kiddos and kind of what's going on in the population. And then Chloe Ann Bobrowski is here with us from CSDE to think about strategies to stop the spread, to think preventative things that we could put into place to keep our staff, our kids just safe. And then I'll finalize at the end with kind of doing just a wrap up. And we kind of want to know what's new at CSDE and kind of looking through the Superintendent's Digest. We have some topics that kind of popped up these last few weeks, so kind of wanted to bring it to your attention. The first one is the annual FERPA and PPRA notice from the U.S. Department of Education. This is kind of a report to talk about the federal law that protects privacy rights of parents and students regarding educational records by educational institutions. So that really is a great report to know how privacy impacts our students and our families. Along with that is a Remote Learning Commission report, and really looking at remote learning and what with schools have in place right now and what that looks like. So that's really a great report to really get the kind of current trends and strategies of what's going on with that commission report. Statement on restraint and seclusion. The other, what I really want to bring to your attention is the e-learning series on attendance and engagement. You can register for that. I will provide that link in the next slide. And it's really important because it goes through kind of the different pieces on kind of those best practices with attendance engagement. It's really an engaging series to help give you those strategies. Along with that, we have an updated definition on attendance, which Kari will speak to a little bit in a few more slides. The new CSDE model curricula for model units connected to defined learning performance tasks. And there is a statement from the Connecticut Department of Public Health Commissioner, which again, we will be talking a lot about today. So that's good reference materials as well. And here is the actual attendance and engagement e-learning series with Attendance Works. So the registration link is actually I put the flyer link, which has the registration link embedded in the flyer right on the slide. And the info session is December 1st. So that's quickly approaching considering we're kind of met mid of November. But session 1 starts January 23rd, 2023. So make sure you register. There's 3 sessions in this, and it's really going to be a great series. So I would highly recommend doing that.
I need to say something about that real quick. So I just really excited about the e-learning series, and we released it last week, and registration is filling up quickly. The information session is a one-time session for district and Board of Ed leaders to come and find out more around what's happening in chronic absence and attendance strategies for the year, and to determine if the e-learning series might be right for one of their attendance teams, their school attendance teams. We're encouraging that teams register for the series, the three-part series. So we're going to be looking at the registration. It's also more tailored for districts who are kind of new to the chronic absence work, who may not have been required by law to have a school attendance team. Opportunity districts have had a lot of time learning around chronic absence. This isn't necessarily targeted to most of the opportunity districts. So I just wanted to say that. And we look forward to working together with HeadyWorks and Attendance Works, Hedy Chang and Attendance Works on this e-learning series. Thank you.
Oh, you're welcome. Agree, Kari. They are a wonderful team to work with. So engaging. So it's well worth your time if you can to attend. Okay. I will turn this over to you, Kari.
Okay, and so on September 7th, the State Board of Education adopted an updated definition of what in attendance means. The standard definition of in attendance has always been that you're present at your assigned school or participating in an activity sponsored by the school for at least half of the instructional school day, and then you can be marked present for the day. But they have added to align with some legislation from last year that if students are participating in statutorily authorized remote learning as determined through a combination of synchronous virtual classes, synchronous virtual meetings, activities on time-logged electronic systems, and or completion of submission of assignments for at least half the day. And so you remember that graphic from early COVID days of the 4 buckets of how students could get credit for being present for half day in the remote learning. So that has been added to our definition of in attendance. We also added students serving an out-of-school suspension or expulsion are reported as absent, except for each day that the student receives alternative education programming for at least half of this instructional school day. And so after this notice went out to districts, I got several phone calls and emails asking about, well, does that mean we have, excused quarantine absences and kids who are sick can get credit for remote learning? And the answer to that is no. So if you want to go to the next slide, please, Christine. We are not authorized in Connecticut to have a remote learning while students are out sick. We are authorized only for, so it's expanded only to include students participated in statutorily authorized remote learning, and that only applies to students enrolled in a remote learning model. Enrolled is key. You have to be enrolled in this remote learning model that is aligned with the standards for remote learning grades 9 through 12 that came out of our academic office not too long ago. Currently, state statute only permits remote learning for students in grades 9 through 12. And so they have to be enrolled in a program, and they have to, the program has to be aligned with the standards for remote learning. They can't just be one-offs. They can't be just say, I'm out 5 days, so can I just do remote learning? That was done through executive, what do they call that? Governor's executive orders. That is not allowed in statute. And so this year that is not continuing. So I put a note here that the new definition does not apply to students who are quarantined or isolated due to illnesses. Students who are absent due to sickness should be marked absent according to the guidelines for excused and unexcused absences. And by the way, a mention of that document, we are updating that document and expect to release it shortly. So it's in review by some of your peers at this time, and we hope to have an updated guidelines for excused and unexcused absences featured on Talk Tuesday probably in January or February. Okay, next slide, please. So it's my pleasure to introduce Kristen Soto from the Department of Public Health, who's going to provide us with the Connecticut Weekly Respiratory Viral Disease Trends Report and let us know all that's happening in our communities around respiratory health. So with that, I introduce Kristen Soto. Thank you, Kristen.
Thank you so much. So some of you may have heard a similar presentation on the Tuesday morning SDE call a couple of weeks ago, but just want to assure you that this is our most up-to-date data, and not surprisingly, things have changed as we've moved through our respiratory viral disease season. There are a lot of respiratory viral diseases that circulate here in Connecticut. But at the Department of Public Health, we specifically collect surveillance information on 3 of those illnesses, and those are respiratory syncytial virus, or RSV, influenza, and COVID-19. And so I just wanted to highlight that what we'll be talking about today in terms of general prevention strategies is really effective for all of these different diseases that are circulating in the community, even if we don't know what exactly is circulating at a given time. But again, we will be focusing on those 3 big players. The other thing I just wanted to say is that obviously I'm sitting at the Department of Public Health as one of the experts on these diseases, but I'm also a parent to a first grader. And so I sort of have that firsthand knowledge of trying to balance these recommendations with having an actual child and know how challenging it can be to make a decision. Is my child well enough to go to school today? Is this their allergies? Is this something more brewing? So definitely going through these guidance, we're trying to keep in mind both what will work for you, what will work for parents and families, and what will work to help keep people healthy and prevent the spread of these diseases in the community. Next slide, please. So when we talk about respiratory viral disease prevention, in the past, we really focused all on COVID-19. And part of the reason for that was because for several years, that was really the only thing that was circulating in our communities. But now we're sort of going back in our time machines to all of the things that existed before COVID-19, in addition to COVID itself, and are really looking again at these broader prevention strategies of how we can keep people healthy and therefore keep them going about their day-to-day activities, including going to school. So one of the most important things that anybody can do 6 months or older is making sure that they get both their seasonal flu vaccine and that they are up to date on their COVID-19 vaccine. So for some of our youngest kids, that would mean just having their primary series completed. But for most people 5 and older, so most of the population that we're talking about in terms of school staff or students, we would be recommending that they receive both that primary series as well as a bivalent booster. The next most important thing is for people to stay home if they're sick. And we know that this is one of the challenging things to balance absenteeism, preserving in-person learning, with keeping people who are really sick and especially those who are infectious out of school. So if a person has a fever, we never want them in school. They should stay home until they're fever-free for at least 24 hours without the use of fever-reducing medication. And the other thing is if a person is feeling too sick to be in school, meaning that they really can't successfully be there and be productive, or if they're really having more severe respiratory symptoms, so they're having a lot of secretions, they're really coughing nonstop, they're really just not well enough to be there, the best place for them to be is at home to prevent the spread of their illness to others. That being said, if people have mild illness, which we know for those with allergies or with sort of the cold of the week that seems to run through schools, especially with some of our younger kids, if a person only has mild symptoms, your district may want to approach the test, mask, go strategy, where if they have mild symptoms, they could test for COVID, make sure that they're COVID negative, and then go to school while wearing a mask to prevent the spread of those symptoms. It's always important for people to wash their hands. That's something that we've been telling people every cold and flu season, and a message that we want to continue to emphasize. And then the last thing that we've really de-emphasized during COVID, but want to put back on people's radar, is routinely cleaning and disinfecting those high-touch surfaces, especially with RSV. If people are touching things like doorknobs or other surfaces and then putting their hands in their mouth or their nose or their eyes, it can cause transmission. And so really looking at all of these strategies together is the best way that schools can set policies about when students are there, what prevention measures they want to implement, what those operating protocols will be, and then also really strongly communicate these messages to parents to ensure that they're sort of encouraging their children to follow these measures and communicating clearly with staff and students about when it's appropriate for them to be in school and when it might be best for them to stay home. And obviously, we're really focused on the individual and protecting the classroom. But this year, especially, we have been seeing a lot of school closures in other parts of the country due to influenza. So we would never say at the health department, you have flu in your school, so you should send people home and shut your doors. However, in other parts of the country, like California, Kentucky, Virginia, we've been seeing really large outbreaks where, for example, in San Diego, there were 400 out of 1,000 people who called out sick on on the same day due to influenza-like illness. And at that point, the schools were not able to operate. So by hopefully putting in place these basic prevention strategies all the time and keeping people home, we can prevent those larger outbreaks that are really disruptive to our ability to operate at all. Next slide, please. And next slide. So for the next several slides, we're going to be focusing on disease-specific information, starting with RSV. RSV has been in the news a lot recently because of the strain that it's causing in our pediatric healthcare facilities, especially CCMC and Yale. For a while, they were really struggling both with their EDs overflowing with people with RSV, their inpatient, and especially their ICUs. In most people, RSV will present as a mild cold-like illness. Most people will not know that they have RSV, and they'll just assume that they have a cold or some other circulating respiratory virus. However, it can cause severe illness in infants, especially those less than 2 years of age, in older adults, or in those with underlying conditions such as asthma. Especially during the time when we were seeing heightened RSV activity, we were also seeing a lot of people being sent to emergency departments and other settings to get testing at the request of their schools and daycares. And in most cases, testing for RSV is not warranted. There's no RSV specific guidance, which would dictate that knowing a person's diagnosis would allow them to stay out of school or return to school sooner. And for most people, treatment is just managing their symptoms. So testing is typically reserved for those who have the more severe illness, where knowing a diagnosis will allow their doctor to treat them appropriately with supportive care. If you are aware that somebody has RSV, or if RSV is circulating in your school, the students may return to school if they're fever-free and feeling well enough to go. Additionally, if they are returning to school, we would recommend the use of masks as part of that larger test, mask, and go strategy for both staff and students. And if you do know that RSV is circulating, we would again recommend emphasizing those general prevention measures, especially the cleaning and disinfection of high-touch surfaces, which can really cause this to spread quite extensively in settings where a lot of people are coming together, like schools. Next slide, please. So there are really two sources of data that we look at, and I just want to highlight that all of the links for the data that I'm showing today are publicly available, and there is a list of resources at the end of the presentation if you want to sort of keep tabs on these different viruses throughout the season. The first set of data that I'm showing you is from CDC, and I realize that most of you probably don't spend as much time looking at graphs every day as I do. But I think what I wanted to orient you to is that this is really showing what's happened with RSV since the start of the pandemic. Looking at that peak in the middle of the graph, that is showing what happened during our 2021 RSV season. Normally RSV will happen during December, January, around the same time as flu, but this really started off at the end of last summer and then continued through the winter. Looking at the far right of the graph, that is showing the present, and you can really just see that purple line taking off straight up, showing that there is a lot of RSV that is being detected and people are being tested for in our communities at this time. Next slide. And those slides really show just half the story. The other thing we care about with RSV is not just who is sick, but how severe those illnesses are. So this is data from RSVNet, which conducts enhanced surveillance for residents of New Haven and Middlesex counties. But we think that pretty similar trends are happening statewide. And you can see that with most of the lines that are in purple and red, those are what a typical RSV season would look like in terms of hospitalizations, with a peak around January. The blue and green lines show what's happened during COVID, with sort of those more blunted curves, not as much activity. And then the green line on the far left is showing our current rates of hospitalization, which are again much earlier and much higher than what we've traditionally seen with RSV. So after being gone for a few years, RSV has basically come back with a vengeance, especially in some of the younger children who have not had previous exposures that they might have had if RSV was more readily circulating. The good news is that these numbers do appear to be plateauing and even decreasing. So we're hopeful that where RSV has taken off so much that it will quickly decline and not be something that lingers, although it is possible that we will continue to see RSV activity for the coming months. Next slide, please. And next slide. So next I'm going to be talking about influenza. The traditional definition of influenza-like illness is either fever with a cough or a sore throat. And again, in most people, they might be sick for a few days and recover, but we're especially concerned about infants, older adults, and persons with underlying conditions because they're the ones who are at most risk of severe disease, including hospitalization and death. For influenza, there is no school-specific reason to test, as there is no influenza-specific guidance. A student or staff member may return to school if they're fever-free for at least 24 hours without the use of fever-reducing medications and they're feeling well enough to be there. However, testing is recommended for flu in general, as there are antiviral therapies that are effective and readily available that can help limit the severity of symptoms if taken early during the course of illness. Next slide, please. So for flu, for those of you who have looked at our data over past seasons, we've traditionally issued a weekly PDF report. This year, we retired that report and moved to a Power BI dashboard, which I'm showing a screenshot of now. And these data continue to be updated weekly on our DPH website every Thursday. Looking at the data for trend, we can see that we've really started to take off with influenza cases for the current season. We started tracking data during October 1st, and you can see that in the top graph, looking over time, that hospitalizations have really been steadily increasing week over week. The lowest bar for November 13th is really just an artifact showing that we don't have complete data for that week yet, but we would expect it to fill in. And then the bottom graph is showing the distribution by age. As we would expect, most of these hospitalizations are in adults 65 and older. However, there are also a significant number of hospitalizations that have been reported in pediatric populations, especially those less than 10 years of age. Next slide, please. And then this graph is showing the number of the geographic spread of influenza-like illness across the country. So if we had looked at this during September, most of the map would have been green, showing that there was really not that much flu-like activity occurring. But week over week, we've been really watching this spread up starting in Texas, moving up the East Coast and moving into the Northeast. Connecticut is currently in the high level of influenza-like activity, most of which we think is attributable to actual influenza at this time. And then looking at sort of the Southeast United States, you can see that that is in the most purple or very high category. And that's really also been creeping up the East Coast week over week. So we anticipate that over time that will continue to reach us as we see more transmission. And I think it's sort of a warning that even though we're seeing high levels of flu now, that activity really hasn't peaked yet for the season, and that we should expect to continue to see more influenza throughout the fall and winter months, especially as people start to move inside with the colder weather and start to gather for things like the Thanksgiving and winter holidays. Next slide, please. And so last but not least, we will be talking about COVID, which I'm sure you guys are all sick of hearing about, but unfortunately it has not gone away and is still an important player that we're looking at. Next slide, please. So I'm sure you guys are all familiar with the symptoms of COVID at this point in time. I think the important thing to emphasize is that there really are a spectrum of signs and symptoms that people can see. There can be asymptomatic transmission all the way up to very severe difficulty breathing or shortness of breath, and that a lot of this is really going to depend on a person's individual characteristics, their vaccine status, and whether or not they've had a previous COVID-19 infection. testing for COVID is important for two reasons. The first is that there are isolation recommendations based on knowing that a person has COVID. So if a person has been diagnosed with COVID, they should stay home for 5 days after their symptom onset or their positive test date if they're asymptomatic. And if they're fever-free and their other symptoms have improved, they can return to their day-to-day activities, including school, if they're wearing a mask through day 10. The other reason the testing for COVID-19 is important is that individuals at higher risk of complications may be a suitable candidate for antiviral therapies, which will help to reduce the severity of their illness. Next slide, please. So this slide has a lot of information on it. Just to orient you to each of these graphs, the blue line is showing the current season. The green line is showing last year's 2021 season, and the red line is showing 2020. And I think the good news is that overall COVID appears to be on the decline. So looking at COVID cases, hospitalizations, admissions, and deaths, all of these numbers are relatively low and stable for the time being. Although we know that it may not stay this way and that we may continue to see surges in COVID-related activity, especially heading into those fall and winter months where we have seen surges in previous years. The good news is that in the most recent waves due to Omicron, which occurred during January as well as during the spring last year, we did not see as much severe disease as we did early in the pandemic. So if cases are increasing, it can be really disruptive to people. They may need to stay home and isolate. However, luckily, the severity for most people is not as high as what was previously reported. Next slide, please. We do look at the rates of COVID by different age groups and have traditionally seen the highest rates of COVID in those 75 and older. Typically then, risk appears to decrease with decreasing age, with children having the lowest rates of COVID-19. Looking at these trends, they've been relatively stable by age for the past several months. However, we did see a little bit of a spike about the second week in September, which we think corresponds with people returning to school. I think it should also be noted that when looking at these data, they are based on our surveillance data, which are the data that are reported to us by laboratories. So this information does not reflect home test kits. And we know that home test kits is the preferred testing mechanism of many people, especially since schools have been really so involved in distributing these kits to their population. So we know that this likely underestimates the true burden of disease, especially in these school-aged individuals. Next page. And then one more slide, please. The last thing, whoops, that is not the school data. I did want to show you the hospitalization data for COVID-19. As I mentioned, typically individuals at youngest ages can be at more risk for some of these respiratory illnesses. And we have had a relatively low pediatric census or people who are actively in the hospital with COVID-19 infections, and that appears to be steadily decreasing since the beginning of September. Additionally, new admissions for COVID have remained relatively low, with 7 new admissions for COVID during the past full week of data, most of those being in the youngest children where we would expect to see the most severe illness. Next page, please. And then for school data, as I mentioned previously, our surveillance data really has a blind spot in terms of the home testing that occurs. However, schools are reporting any new onset of COVID-19 that they're aware of in either staff or students on a daily basis. As mentioned previously, we did see a bit of a blip in the middle of September, which corresponded both with the scaling up of reporting as well as the return to school and circulating of those germs as kids are coming back together. Since that time, we've really seen a bit of a decrease and plateauing as we've sort of moved into our stable state for the fall, both in the number of staff and students that are being reported, as well as the number of schools reporting any cases. There was a bit of an uptick the first week in November, but that was during a time when we were doing enhanced surveillance to try to reach out to school districts that had not previously reported any COVID cases for the season. And so that is reflective of some batch reporting as schools caught up on their reporting. But just wanted to again thank you for submitting this data to us and really emphasize that this is used both to understand what is going on with COVID in our schools, as well as for potential outbreak and cluster detection. Next slide, please. And next slide. So I believe the last surveillance measure that I'm going to talk to you about are the CCLs, or CDC COVID-19 community levels. These are a mix of different measures related to both hospitalization as well as cases in the community to both understand what is going on in terms of disease severity, as well as the potential for healthcare strain. And these measures are tied to public health recommendations. And I think the most notable one that many people focus on is the recommendation for universal indoor masking when a single county is orange or in the high risk category. Currently, all of our counties in Connecticut are in the medium risk category, with the exception of New London, which is in the low risk category. And this is primarily being driven by the low rates of COVID transmission that we're seeing in the community at this time. Although again, anticipate that this might change as the winter progresses and we do start to see more respiratory viral disease circulation in general as people move indoors. Next slide, please. So this slide is just a summary of all of the data that I presented and where it's all posted, either on the CDC or on the Connecticut webpage. And I'd invite you to sort of keep tabs on these data throughout the season if you want to know what's going on statewide or in your local community to better understand what's happening in terms of RSV, influenza, or COVID-19. And those were all of the prepared slides that I had for today. I'm happy to pause and take any questions that people might have, or if not, I know that Chloanne will be discussing respiratory viral diseases and different prevention strategies from a slightly different angle in more detail following my presentation of this data.
So if anyone has any questions, feel free to raise your hand or just open up your mic and ask, or if somehow you can't, also the chat box is open as well. You might not have one at this time, which is fine, because after Chloanne, we also have another kind of Q&A time where if you have a question, so again, you could ask your question on Kristen's presentation or after Chloanne as well. So feel free if something doesn't resonate right now, but you have a question later on, we could do that. And lots of thank yous for the information, Kristen, coming through the chat. All right. Well, thank you so much, Kristen. And just making sure, okay, just making sure we got everything. So Chloanne, I will move forward to your slide deck, and it is, and you could present right now. Let me know if you need anything.
Okay, thank you very much. Well, thank you all for this opportunity to be here with you today. I also want to thank Kristen Soto for her presentation this morning. Thank you so much for being here and really giving us the data of the current circulating viruses in our communities. My name's Chloanne Bobrowski. I am an education manager with the Department of Education for School Health and Family Support Services. As you can see, my background is in nursing, and I was a school nurse and a district supervisor for a district in Connecticut prior to coming to SDE. So this topic is very near and dear to my heart. So I guess we can go to the next slide. So CSDE and DPH, as Kristen had mentioned, continues to host Health and Safety Tuesday meetings with school districts that involves administrators, school nurses, local public health officials, and anyone who really would like to attend the meetings. They occur every other Tuesday from 8 to 9 in the morning on Teams, and it gives the districts opportunities to ask questions. And as again, I feel like I'm really going to follow up with just kind of reiterate a lot of Kristen's information, but it gives districts the opportunities to get updated on any guidance and ask questions and feel like they can get support from DPH and SDE. So the big takeaway right now, as Kristen had mentioned, was to continue to use mitigating strategies, get the most up-to-date vaccinations for COVID and flu, to stay home when you're sick, get tested if you're symptomatic or have had an exposure to someone with COVID as a close contact, to continue to perform hand hygiene, wash your hands, and to continue to clean surfaces. I can also say that yes, our school districts are still reporting COVID to DPH so that they're able to determine the incidence of COVID in schools and also to identify any outbreaks or clusters. So we appreciate the schools that do continue to report to DPH. Next slide. So again, I'm going to be talking a little bit more about COVID, flu, RSV, and then I'd like to add to this discussion this morning, not a viral illness, but a chronic medical illness that really affects a lot of students in our schools. So I'll be kind of expanding a little bit more on asthma. So we do know that with the circulating viruses and even fall allergies, it may be very difficult to tell why someone's sick. Kids often have a cold or an occasional cough, and that may be okay to send to school. But if secretions are great, or the cough is persistent, or definitely if the student has a fever, they should test, they should stay home, they should test for COVID, and may come back to school when their symptoms resolve. Again, guidance for anyone who tests positive for COVID is to stay at home and isolate for 5 days. And if their symptoms have improved, they can come back to school wearing a mask from days 6 through 10. And as this year, close contacts do not have to quarantine, but they should monitor their symptoms, 4 symptoms daily, and test 3 to 5 days after an exposure to somebody that's had COVID-19. Next slide. So, yeah, we're going to go right to COVID versus flu. Again, you cannot tell the difference between flu and COVID by the symptoms alone because they have some of the same signs and symptoms. So specific testing is needed to tell what the illness is and to confirm a diagnosis. Next slide. Basically, the takeaway on this very wordy slide is that most upper respiratory illnesses are spread in a very similar fashion. It's usually by droplets or aerosolized particles, and often by surface. So a person can get infected by touching another person or by touching a high touch surface or a table that especially with RSV, that tends to stay a little bit longer on surfaces than touching their own mouth, nose, or eyes. The one thing with COVID-19 is that it does seem to spread. It is more contagious, so and can spread quickly and easily to a lot more people. So we want to continue to use our strategies and think about when you're not feeling well to stay home, test yourself so you don't spread to others. Next slide. One thing that we talked about earlier is also about the importance of receiving your vaccines. The flu vaccines are important to keep the schools healthy and open. Its CDC does recommend that everyone get their flu shot in September or October. Or at least before the holidays start, when people begin to start their celebrations. It takes 2 weeks for protective antibodies to build. So if you haven't gotten your flu shot, even like by today, then I strongly encourage everyone to schedule one, and also message this to families. The flu shot is a quadvalent shot, which means that the formula is selected based on what scientists have predicted to be the top 4 circulating viruses this season. The COVID vaccine is a bivalent vaccine, which gives added protection against the Omicron viruses and its subvariants as compared to the original formula. This bivalent COVID vaccine is available to anyone 5 years and older. So basically that's our entire school populations of students who attend school K through 12. So again, just, messaging that families should consider receiving their COVID-19 vaccines. One thing that I think that comes up very often is whether or not these shots are mandated to attend school. They are not. A flu vaccine is mandated for pre-K students, but not after when kids start to school as kindergartners. And the COVID vaccine, of course, is a recommendation, but is not a mandated vaccine. I think we often get questions from families that they think that these vaccines are mandated, but they are highly recommended. All right, next slide. Okay, so just to kind of recap, again, with respiratory syncytial virus, RSV, it is at a high level right now, and many children are hospitalized for this, and adults can get it too. This is a virus that infects the lungs and the respiratory tract and therefore can cause difficulties in breathing, and as well as a number of the symptoms that you see on this slide. This is a common condition. In fact, by the age of 2, most children will have already been infected by RSV at some point. And in older adults, the good news is that it's milder and it's easy to respond. It responds well to self-care measures and is generally self-limiting. All you need to do is rest, take care of yourself, and the condition will normally go away on its own. The difference is that it's really kind of tricky distinguishing it from just the common cold, but it's also treatment for the common cold or RSV is essentially the same. So it really, doesn't really matter in the long run, exactly. So next slide. And next slide. So again, RSV is spread with a cough or sneeze. So ways to decrease the spread is actually covering your cough, respiratory etiquette, hand hygiene, cleaning surfaces, and staying home if you don't feel well. And this slide, there is no vaccine available for RSV. It's just a seasonal illness. And, as indicated, it can be deadly for babies or elderly people or others who are immunocompromised. So we just really just need to keep washing our hands and staying home if we're sick. All right, next slide. And I've kind of gone over this. So next slide. All right. So now I kind of want to turn the focus onto asthma. Asthma is a leading cause of chronic disease-related absenteeism in school. Students will experience fewer missed days from school when parents and school administrators work together to address risk factors for students with asthma at school. A healthy school environment is a key factor in asthma management. Next slide. I just wanted to bring to your attention that every 3 years, the Department of Public Health completes a survey for asthma surveillance report. This was just recently published onto our DPH website. This report is conducted throughout every school in the state of Connecticut. The school nurses report in elementary school, middle schools, and high schools, the incidence of asthma and the number of students that they have in their schools. Currently, the nurses are beginning to submit their data now for the 22-23 report. So overall, you can see in 2020, asthma prevalence among students in the Connecticut school system was 12.9%. This is approximately 1 of every 8 students in the Connecticut school system that's affected by asthma. And I talk to school nurses very often about asthma, but I'm very I'm very pleased to be able to give you this information as well, because we don't always get to be able to discuss these findings with other staff members in our school districts. And it's a very big, important topic. Next slide. So just wanted to just kind of read this slide out loud, that school administrators know that numerous factors from family support, language skills, academic readiness to physical health affect a child's academic success. Children cannot learn if they are hungry. They cannot learn if their teeth hurt. Children also cannot learn if they cannot breathe. Asthma is this nation's most common chronic childhood disease, affecting more than 5 million school-aged children. Children miss an average of 14 million school days each year because of asthma. Talk about a negative impact on academic performance. Next slide. So this is old data. I wish I'd had something a little bit more, but this, in 2003, 61% of children with asthma missed school days. Next slide. So here is just the slide that really kind of talks about our current asthma prevalence by school level. As you can see, the first column in elementary school, the total prevalence of students with asthma is 11.7%. It affects males greater than females. And with race and ethnicity, you can see quite a statistical difference on how asthma affects non-Hispanic Black, Hispanic, and non-Hispanic population. And then with non-Hispanic white at 9.9. We continue to the middle school, where we have an increased prevalence at 13.3%, again affecting males greater than females, again with the same significant increase for our non-Hispanic Black, Hispanic, and non-Hispanic other populations as compared to non-Hispanic white. And again, the trend continues into our high schools at 13.8% total prevalence, and the same type of increased incidence in non-Hispanic Black, Hispanic, and non-Hispanic white. This truly really is data to suggest that we do have an increased prevalence of asthma for schools with a more diverse population, maybe inner city schools, and this can be a significant problem for absenteeism. Next slide. Thank you. So I do want to talk about how schools, we can help families understand that school nurses and schools can help manage asthma symptoms and provide the necessary intervention for managing their child's asthma in schools. We know that we have staff and nurses who can help families bring their medications into school, monitoring the medication in school, making sure that they have enough medication, notifying parents and families if the medication has run out, when to bring a new one in if the medication has expired. We also in the schools we would like to receive with every student who has asthma an asthma action plan. Now this plan is completed by the primary care provider. It's also signed by the parent, and it's kind of it really kind of helps have like increased interventions when our students with asthma are either exposed to a trigger such as dust, pollen, a cold. So it identifies the triggers, and then it's divided into 3 different parts. The go zone, which is like the green, the student is well and healthy. Perhaps they're on a continuous medication or their preventative medication, and they're feeling great and they're ready to learn. The caution or the caution zone, which is yellow, is when a student becomes maybe exposed to one of their triggers or the first sign of an illness. We can kind of kick up the intervention piece in the school system, where instead of taking just their maintenance inhalers, we can increase the number of rescue inhaler, whether it increases the dosage, increases the frequency, but this is somewhat of a response so that we could hopefully kind of cut things off at the pass and increase in interventions at the school. So we don't always get these action plans, but they are really helpful to try to keep our asthmatics from becoming sick, especially during this cold and flu circulating times. I lost my train of thought. And we'd like to use them because we can increase our interventions. So it's important that we do really try to get these action plans in school. And another thing is healthy indoor air quality. We know that that inadequate air quality exacerbates serious health problems, including asthma. So again, we have some suggestions for how to improve healthy indoor quality, because which includes improving ventilation, removing allergens, ensuring proper maintenance of heating and air conditioning systems, installing HEPA filters, and planning for ongoing improvement of the indoor environment. Because with regards to air quality, what could be in the air? Well, we have the people who come into the building. They may carry organic compounds like perfumes. They might have some essential oil diffusing. They may carry in a virus. When you think about what's going on in the building, people are tracking in dirt. There's construction and renovation activities. There might be some compounds such as art supplies or industrial art products and construction renovation activities that could trigger an asthma attack for somebody. The building may have new furnishings that may have like some strong smells. And then what's going on outside of the building? If there's nearby construction, if there's emission from buses or traffic or parking lots, biological contaminants that like standing water near a ventilation intake, grass cutting and pollen. These all are things that can contribute to a poor indoor health air quality. And we know that in schools in Connecticut, we know that many have documented poor indoor air quality or environmental quality, but there has been few resources to address them. So maintenance budgets may often be the first to go when funding is lower, and grants for upgrades are very competitive. We do have the U.S. Environmental Protection Agency's tools for schools that continues to be an effective and practical intervention to address indoor environment quality. And since it really works with a team of parents, staff, and students to look at their schools, educate their fellow staff, and maybe make an action plan to address some of the problems. And I am curious to know if any of the people who are here today on this call actually still have a tool for schools team that if it has been ongoing or if it's been maintained in your district. We do know that there has been some changes with Department of Public Health who really spearheaded this. And it really is a good program for schools to try to look at healthy indoor air quality. I think one of the things that came out of COVID is that we really have, it's important for good air ventilation and quality of good indoor environment quality. Okay, so let's go to the next slide. So another thing that I wanted to talk about is with the attendance guidelines for excused and unexcused absences. I'm not sure if you all know, but school nurses can help with your documentation once you get to that 10th absence and the student is sick. A school nurse, according to guidance, a signed note from a medical professional who may be the school nurse who has evaluated the student confirming the absence can give a signed note to excuse that absence, or a signed note from the school nurse who has spoken with the student's medical professional and confirmed the absence, including the date and location of the consultation. Parents may also wish to bring in their student to consider having the school nurse assess the student's chief complaint and determine if the child can and should stay in school. That's often something that, kids may not feel well, or they think that they don't feel well, but if they can get them into school, we can take their temperature and kind of assess them for any kind of illness, and then, encourage students to come to school that day. And next slide. And if your district is fortunate enough to have a school-based health center or a few school-based health centers, these are staffed by nurse practitioners. They can provide physical exams, immunizations, and diagnosing and managing chronic illnesses, and writing prescriptions. And I just want to take a moment to, as I conclude my presentation here, that we should ensure that the school health staff are included in both the district and school attendance teams to assist with attendance issues related to immunizations, health barriers. Nurses aren't equipped all the time, and I know this might be a problem for your attendance teams to be able to leave their office just for the nature of their business. They're constantly having students arrive into their health office, so it's not, and they don't have subs, so it may not be easy for them to be able to leave their office to attend a full meeting. But if there's an option for them to be present, a virtual option, if you could bring them in that way, or if they can come to the meeting, maybe present some information on disease surveillance, or if they've got some health information on a particular student that has, that is coming up during your discussion, and also maybe emailing the nurse after your attendance so that you can hopefully connect with a student and their family if it's related to a health issue. Often school nurses have a relationship with families that may assist attendance teams with connecting with them. I know that my own personal experience as a school nurse is when COVID hit and I was on the attendance team, I really was the only one that kind of knew this family, but they had become sick with COVID and they were home, and this was during 2020 in the early part where we were just really trying to get the kids to log on and get back into school. So even though they weren't able to come into school, we were at least able to connect with that family, which is the important, what we're talking about today is connecting with families so we were able to connect with the family, bring them food, ask them if they needed anything else, and really know that we supported them and we wanted them in school. So I feel like this is a good example of how maybe a school nurse or a school health staff can assist you with your attendance teams. And I think that might be the end of I just have my question slide if anybody has any questions for me.
Please feel free to unmute, put your questions in the chat, or just raise your hand if you have any questions for Chloe-Ann or Kristen as well.
Thank you, Christine and Chloe-Ann and Kristen. This has been great. I'm looking at the time and
wow.
we're running close to 11 o'clock. And I just want to say that this is amazing information and these slides will be really helpful for folks who especially couldn't be here today. And the links especially will be helpful for keeping up to date with the data. Many of our school districts are now required to have school attendance teams or district attendance teams, and health is one of the reasons students are missing so much school. So we need to find a way to, make sure families understand when to come to school and when to come back to school, and to sort of return to school on time. And so we don't have prolonged absences if not necessary, both staff and students. And this is definitely, all of these items are things you should be talking about with your families and with your school and district attendance teams. So if you haven't had help on your attendance team agenda recently, it might be a good thing to have for discussion in the near future, because as we enter, I don't know if I've heard this, but as we enter the holiday season, and if you remember last year when we came back after Christmas, and that we really saw an increase in the number of absences due to respiratory illness. And so we want to be prepared for that. And we want to improve attendance, but most importantly, I'm thinking we want to right size attendance. We want to make sure that the kids who aren't supposed to be coming to school know that they're not supposed to come to school, and to identify those students who should be coming to school and helping them remove those barriers and develop those relationships with families. So with that, Christine, do you want to do the last slide?
Sounds good. So Talk Tuesday, kind of our upcoming sessions. So we have November 29th, which you are going to have from DCF. Caroline and Stanford Youth Services are going to join us. And December 13th, Innovative Strategies Stay on a Course, brought to you by EdAdvance, and with our participating district with Montville Public Schools. So we're going to look forward to those on the horizon. And December 13th will be our final Talk Tuesday just of this year. We will start again in January, but we understand the holiday break is approaching. So just to kind of keep that in mind as well. And of course, here's our contact information. At any point you need to get in touch with us or even to get in touch with our presenters through us, please feel free to. Here's our email addresses and phone numbers. And I thank you everyone for participating today, for being here. Chloe and Kristen, thank you for a great presentation, and Kari for the information as well.
Thank you.
Hi, Kate. I see your message in the chat.